Blood clots are called silent killers, not for the sake of a loud effect, and because most often they are formed unnoticed. There is no bad tooth, which will make you run to the doctor. There is no obvious wound, which will require a band-aid. There are years when the internal environment in the vessels gradually changes, the blood becomes less fluid, platelets more sticky, and the endothelium is more vulnerable. And then one day the invisible process produces a visible result. Heart attack, stroke, thromboembolism. The risks increase with age, but the influence of habits on these risks is also. This conversation is not about miracle cures or about abandoning medicine. We will analyze the clear, accessible, and, the main thing, a realistic way to support the body's internal river is a morning glass of natural tomato juice without salt or sugar, with a drop of unrefined oil for better absorption of lycopene. Why exactly like this? Because we are talking about an element of everyday life, which is easy to repeat day after day, which works smoothly and in the right direction, helps maintain a healthier vascular wall, affects the tendency of platelets to stick together, adds potassium and antioxidants to the diet. Let's set the boundaries right away. Tomato juice does not cure thrombosis, not comparable in strength to anticoagulants, and does not replace prescribed treatment. It doesn't thin the blood like a pill. He creates the conditions in which it is easier for the body to maintain order, less roughness inside the vessels, more antioxidant protection, less salt and sugar in the morning. And if such an action is repeated hundreds of times, a habit is formed, which really changes the background. If the topic of vascular health is relevant to you, answer yourself a simple question. Have you ever thought about the thickness of your blood? Yes or no is already a useful mark, and a like and a subscription are a sign that you need honest materials, and we are moving on the right course. What is thick blood in simple terms? We often use the expression thick blood as a convenient metaphor. In medicine, they talk about viscosity and fluidity. Viscosity increases when there is relatively less water and more substances in the blood, which increase the resistance to the flow-formed elements, plasma proteins. It is affected by dehydration, fluid loss during heat, viral infections, taking certain medications, excess salt, alcohol. Inflammation affects, quiet, low translated from Russian to English, www.onlinedoctranslator.com intensity, which accompanies many chronic diseases. Hormonal changes have an impact, low mobility, smoking. How does it feel? Different people have differently. Who has it? That's like fatigue, as if there was a heavy environment inside. Who has it? That's like cold palms and feet. Who has it? It's like a fog in my head when it's hard to get. Together, it gets worse in the heat and after feasts. When the water returns, movement, sleep, life brightens. This is it. What can we regulate? Thick blood is not a diagnosis and factor with which you can work with habits. There is also a second dimension, flow speed. Sitting for long periods of time, dehydration, constricting clothing, varicose veins. All this slows down the blood flow in certain areas. Slow flow plus vulnerable endothelium. And platelets have work there where it shouldn't be. The goal of prevention is to prevent these two factors from meeting too often. How and why blood clots form. Platelets are not enemies and the rescuers. When injured, they are the first to close the hole in the vessel. The body does this quickly and efficiently, otherwise any scratch would become a disaster. The problems begin when the repair signal appears there, where there are no holes. It happens if the inner surface of the vessel, the endothelium, is damaged by oxidative stress, tobacco smoke toxins, high glucose levels, chronic inflammation. Imagine a perfectly smooth pipe. Water glides freely. Now imagine a pipe scratched from the inside with fine sandpaper. Uneven surfaces are more likely to attract debris. The role of waste is played by lipid particles and platelets. This is how layers appear. Plaque, base, and a plaque is also a narrowing of the lumen and a platform for blood clots. What makes the situation especially dangerous? Breakaway clot. A small fragment carried away by the stream can get stuck in a critical place, in the coronary artery of the heart, in the cerebral artery, in the pulmonary artery. The result was a heart attack, stroke, thromboembolism. Home remedies don't work here, only emergency care works. Remember the red flags: sudden squeezing pain in the chest, radiating to the arm, jaw, sudden shortness of breath, sudden weakness or numbness in the arm, leg on one side, speech or vision impairment. Impact: headache, sudden swelling and pain in one leg. If you experience these symptoms, call an ambulance immediately. What are the benefits of tomato juice? Why even talk about tomato juice when there are medications? The answer is simple: because nutrition is the background on which medicines work and on which the body lives 24 hours. And because tomatoes have a good combination of substances that support the processes we need. The first is lycopene. It is a fat-soluble carotenoid, which makes tomatoes red. It helps protect the endothelium from damage by oxygen radicals. To put it simply, maintains the smoothness of the inner lining of the vessel. The smoother it is, the harder it is for platelets to stick without a reason. Second, natural salicylates. This is not pharmacy aspirin, but related plant compounds. In some people, regular consumption of tomato products is indeed associated with a moderate decrease in platelet stickiness. The effect is soft. It cannot be equated with therapy. But for the morning ritual, which repeats for months, this is a good advantage without the cost and side effects of medications. Third, potassium. It helps maintain normal electrical activity of the heart and affects blood pressure. There is a lot of potassium in tomatoes, and this is more important than it seems. Adequate potassium in the diet is one of the pillars of friendly pressure. Fourth, vitamin-canned polyphenols. They work in tandem with lycopene, enhancing antioxidant protection. Any single ingredient alone won't work miracles, but together they create an environment in which the pipe inside remains smoother and the river flows more calmly. Why no salt or sugar? Salt is the enemy of the morning ritual. Sodium retains water, increases blood pressure, and puts more strain on the heart and kidneys. Many ready-made juices are generously salted for flavor and shelf life. But we want the opposite effect, to make the pump work easier, and not to complicate things. So no salt. Sugar is also a no-no. It adds extra calories and triggers glucose swings, especially if you drink sweet juice on an empty stomach. We need a smooth start, a glass of plain water, then natural tomato juice without sugar and only after a break. Breakfast. Why oil? Lycopene is fat-soluble. So that it is fully absorbed, a guide is needed. Half a teaspoon of unrefined olive oil, flaxseed or aromatic sunflower oil, mixed in a glass, dramatically increases the bioavailability of lycopene. This is a small trick, with a big meaning. Temperature, room temperature, ice-cold juice on an empty stomach is a common cause of cramps and heartburn. 2 cooking methods and product selection. The home method is the most manageable. Take it 3 ripe, fleshy tomatoes per glass, 250 mm. Wash it, Remove the stalk, cut and grind in a blender until smooth. If you like a smooth texture, strain it through a sieve. If you want more fiber, leave the skin and seeds. Cook just enough. How much will you drink? Freshness is important. If there is no time, choose directly squeezed juice. The label should contain one word in the ingredients list: tomatoes. Without salt, Sahara, pepper, vinegar, flavorings. Store in the refrigerator. Don't stockpile open bottles. The taste and properties change quickly. Common mistakes: buying tomato drink with salt and sugar, using sauces instead of juice, improving the taste with salt and pepper. Attempt to boil juice. Lycopene is thermally stable, but we get a different dish and not a morning drink on an empty stomach. How to drink. Mode, volume, duration. The steps are simple. Woke up and drank a glass of warm water. Through 10-15 minutes, 200-250 ml tomato juice, room temperature, stirring in 1 or 2 teaspoons of unrefined oil. More in 20-30 minutes. Breakfast. Protein: egg, cottage, cheese, fish, yogurt without sugar, some whole grains, vegetables. This is how the day starts without the salt and sugar swings. Duration: start with 3-4 weeks daily practice, then take a break. 2 weeks. If everything is comfortable, can be repeated in courses. There is no need to increase the volume. The effect is not proportional to the liters, and the gastrointestinal tract may object to excess acid. If it's hard on an empty stomach, take a couple of sips of water during the first few days. Then juice and breakfast is a little earlier. Then return to the standard pattern. Who should discuss this with a doctor in advance? Safety is more important than ritual. Discuss the idea. Are you taking anticoagulants, warfarin, dabigatran, apixaban and others? Or antiplatelet agents, aspirin, clopidogrel? Tomato is food, but there is a potential effect on platelet aggregation, and your doctor should know about the ritual. You have chronic kidney disease or a tendency to hyperkalemia. Excess potassium in the diet, in this case, is undesirable. Do you suffer from severe gastroesophageal reflux, gastritis? Tomatoes can increase heartburn. Sometimes warm juice helps, a smaller portion, or not strictly on an empty stomach. But the decision should be individual. You have allergies for tomatoes, other nightshades, or migraine episodes provoked by certain foods. You are in pregnancy, lactation, or have recent exacerbations of pancreatitis. And the main principle: morning juice is not a reason to change or cancel prescribed therapy. Improving well-being is joy, but only the attending physician can change the doses and regimens. What to expect? What do people most often notice through 10-14 days? A little more clarity in the mornings, less heaviness in the legs in the evening, more even pressure figures, all other things being equal. Gentle support for bowel function due to water and fiber. These are small but pleasant changes. What not to expect: plaque dissolution, instant liquefaction, protection against all blood clots. Dangerous conditions are influenced by a combination of factors: genetics, age, diseases, lifestyle, treatment. Our ritual is a small contribution. He is valuable when stacked with other small tabs every day. A useful habit is to keep short notes. What and when did you drink? How did you sleep? How long did it take? What is the pressure pulse? How are you feeling? This is not bureaucracy, and a way to see your dynamics and adjust your course in time. How to integrate it into your life and enhance its effect without going overboard. Make the ritual physically comfortable. In the evening, wash the tomatoes or put a bottle of direct pressed juice in the refrigerator. Leave a glass and a small bottle of unrefined oil on the table. In the morning, you won't have to look for a ladle. Everything is at hand. Strengthen your base in parallel. Water, a simple viscosity stabilizer. Focus on the light straw-colored urine. Movement, 20–30 minutes brisk. Walking daily. This improves microcirculation and reduces congestion. Plate vegetables and protein at every meal. This will reduce cravings for fast carbohydrates. Fewer sugar fluctuations. Fish twice a week, source of omega-3. This is a separate thread about blood vessels. Salt less hidden sodium. Sausages, cheeses, sauces. Alcohol carefully, it dehydrates and disrupts sleep. Dream, regularity and silence. Lack of sleep increases the pressure and stickiness of the internal environment. This list is boring, but it works, because it's a base. Morning hour might look like this. Water, juice, 10 minutes of quiet breathing, or a walk around the apartment, breakfast. It doesn't require heroism, but it gives a feeling of control over the day. Questions and answers. Can I drink juice in the evening? Can if the morning is overloaded, but on an empty stomach in the morning is optimal. Less competition with food, a smoother start to the day. In the evening, tomatoes sometimes increase heartburn in sensitive people. It's okay to dilute with water. Yes, if the taste seems rich. Dilution with 1:3, 1:2 warm water is acceptable. Just don't add salt and sugar. Is a tomato suitable? Puree? Passata? As a culinary product, yes. As a morning drink on an empty stomach, that's all. It's worse. Thick texture, spices and salt are more common. We need juice without additives. And with diabetes, natural tomato juice without sugar has a low glycemic load. But any changes to your diet if you have diabetes should be discussed with your doctor, nutritionist. It's best to drink juice as part of your morning plan and be sure to consider your total carbohydrate intake for the day. If I don't like the taste, try different varieties of tomatoes, warm temperature, easy dilution with water, a couple of basil leaves, infused in juice, 3 minutes, then removed. But don't add salt and sugar. This will disrupt the logic of the ritual, or use tomatoes as part of a meal and replace your morning ritual with a glass of water and another vegetable practice. Is it possible to drink every day all year round? Theoretically, yes, if there are no contraindications and the gastrointestinal tract is comfortable. It is practically useful to make courses 4 weeks with a 2-week break. This makes it easier to evaluate the effect and not get bored. What if the pressure is low? Tomato juice itself does not significantly lower blood pressure. But if you are prone to hypotension and feel weak, try a smaller portion, not strictly on an empty stomach, and monitor your well-being. Common mistakes and how to avoid them. Mistake number 1. A little salt for taste. The result is water retention, higher morning pressure. The solution is to add a drop of good oil for softness, and if necessary, dilute the juice with water. The second mistake is the more, all the better. Liters of acid on an empty stomach are almost a guarantee of heartburn. Stick to the 1 glass guideline. Mistake number 3. Ice cold from the fridge. A sharp cold in the morning triggers spasms in many people. Drink at room temperature. Mistake number 4. If it's useful, I'll replace the pills. No, this is a path to disaster. Food is an ally and not an alternative to treatment. Mistake number 5. I'll pour oil on a tablespoon. This way, more lycopene will be absorbed. 1.2 teaspoon is enough. More is excess fat, heaviness. Mistake number 6. I have heartburn, but I will endure for the sake of benefit. No need to endure. Reduce the portion, make the juice warm. Transfer the intake from an empty stomach to a time after 15, 20 minutes before breakfast, and if symptoms persist, refuse and discuss alternatives. Mistake number 7. Store-bought tomato drink is the same thing. No, read the ingredients carefully. We need a product without salt, sugar and additives. Soft plan on 28 days. Week 1, we're getting used to it. Every day, a glass of warm water after getting up, through 10 minutes, half a portion of tomato juice with 1/4 teaspoon of oil. Let's look at portability. In parallel, 15 minutes of leisurely walking. Week 2, we are reaching the standard. Full portion, 250 ml, 1/2 teaspoon oil. Breakfast in 20-30 minutes. We record the pressure, pulse 3, for once a week, we note our well-being and sleep. Week 3, let's fix it. Add 1 evening walk 15 to 20 minutes, we're trying 1 fish dinner this week. Be careful with salt in dishes. Juice, unchanged. Week 4, we evaluate, compare the weekly diary, and week C4, morning, legs, head, pressure. We decide, should I continue for another week or take a break? Weeks, if the practice is comfortable, hooray. If not, don't break yourself. And we choose another useful habit. In the pause, you can leave the morning with water and breathing and move the tomatoes to lunch as part of the vegetable plate. Blood clots, topic in which regularity and common sense are valued. A glass of natural tomato juice without salt and sugar in the morning with a drop of unrefined oil. This is not magic and not a replacement for therapy. It's simple, an accessible and understandable step which supports the endothelium, helps platelets behave more calmly, adds potassium and antioxidants to your day. The value is in repetition, and in that this step clings to others, for water, for the movement, for moderation, in salt and sugar, for respect for sleep. If you have already tried this ritual, tell me, how are you? Did it get any easier this morning? How did the gastrointestinal tract respond? Were you able to maintain regularity? And answer briefly, have you ever thought about the thickness of your blood before? Yes or no? Your feedback helps us choose topics and explain them in simple language. Subscribe. Your support allows us to make calm, honest, and truly useful health news, without fear and without big promises. Take care of yourself and your blood vessels. They work for you 7 days a week, and you can answer them in small letters, but with faithful steps every day.